I've had 2 different episodes of back pain, leg pain. The second time around, it was brutal. From the awakening hours to the sleeping hours, walking was affected, sitting was affected, standing. Both my boys were home from college. So the inability to go out and do things with them, the only time I really got to spend with them was when they were taking me to work because I couldn't drive. Ironically enough, in our own clinic, I was probably the worst looking individual in that clinic. I can't pinpoint anything other than I have some congenital changes in my spine. We get older, we have a shelf life on our parts, and things just get worse over time. But what was really concerning was that I was losing strength in my right calf. I couldn't rise up onto my tippy toes on my right foot. I mean, literally, I came in here for an appointment on a Thursday afternoon. It was 2 o'clock, and I was miserable. It was a 9+. I never say 10 because when I have my patients tell me that, then I say, well, why are you here? You should be in the hospital. But at that point, Dr. Demers walked into the evaluation room. I was kind of standing and fidgeting and leaning over the treatment table. And he says, you're pretty miserable. I said, I am. He said, you want to do surgery? I said, yeah, what are you doing tonight? And he said, well, I have a cancellation tomorrow morning. And I said, I'll take it. Being associated with SNG for the duration that I've been a PT in Reno for almost 25 years now, and knowing Dr. Demers and the rest of the surgeons at Sierra Neuro, it was just a really comfort level of understanding their quality of surgical skill. They're going to operate when they need to. They're not going to have the scalpel in their hand ready to cut on anything. I just trust him. I've worked with plenty of his patients. I've seen his outcomes. I've seen his patients get better. It was an easy decision.
When I first met him professionally as a patient, but what I also told him was that we would try everything that we could think of non-operatively before offering him the surgical route. Initially, I did a discectomy, a laminectomy, and a discectomy on him. A discectomy basically is making a very small incision in the middle of the back and then taking a small little piece of bone out to be able to give us an access corridor where we are able to see the sac that holds all the nerve roots and to see the individual nerve root itself. And then we take out the part of the disc that's putting pressure on that nerve root. The symptoms almost always get better, both back pain, but primarily the buttock and leg symptoms and the leg weakness that he was having.
When I got up on the recovery table, things were already different. Then I went to stand up and load my weight through the right leg, which usually was a lightning bolt. There was no lightning. It was gone. Couldn't speak highly enough of the quality of care that I received.
He was very motivated to get better, and so what we're trying to do is get him back to be able to do the things he wanted to do.
Thanks for getting me back on the mountain, back on the golf course, and back in the game of life.